So we are live now.
Thank you. Uh, Good evening. I'm Dr. Nilesh Balkawade, Clinical Head at Oasis Fertility, Pune. I welcome you all to today's session. And today's session is on adolescent health issues and fertility preservation options. Foxy celebrates Adolescent Health Day on 7th of September, and we are celebrating Adolescent Health Week this first week of September. Adolescent health is a very important aspect of any growing nation because adolescent population forms the future adult population of that nation. India has got the largest number of adolescents in the whole world, and this is the task force which is going to be adults in a few years from now, and grooming them, nurturing them is very important. Adolescent health disorders can form a very important group of patients. This includes mental health problems, problems with their physical health, obesity, and more importantly, adolescent cancers. Many forms of cancers are also common in adolescence, and out of these, we know that we have seen lots of celebrities suffering from cancers, and we can get out from these cancers and have a good life later on. So, excuse me, excuse me, sorry. So basically, we can lead a proper healthy life after we get through cancer, and this is a very important aspect which we need to know. Adolescents are young adult populations, and they have, if they survive the cancer, the detection of cancer is in stage 1 or 2, and if they survive the cancer, the future fertility or reproductive potential is of utmost importance. Cancer is a disease where cells grow out of control and invade and erode the normal tissue. There are many forms of cancer, and many of them are preventable cancers. So, prevention of tobacco use, prevention of obese or overweight, cancer causing pathogens, and getting vaccinations against HPV, poor dietary eating habits, this can be avoided, and some cancers can be prevented. If there is a history of uh, losing weight, if there is a history of feeling worn out for no reason, if there's a history of lump in any of the body parts, history of itching over the skin, or history of excessive sweating, and all these symptoms direct towards the presence of cancers and adolescent health disorders. Adolescents, their cancers, most of these cancers are a rare occurrence, but if they occur, there are chances of high grade malignancy in them. Education of primary healthcare for reducing the referral time to oncologist is of utmost importance when we are dealing about cancers. Optimization of the clinical environment with dedicated spaces for detection and management of such diseases. Psychological support group should be there. Multidisciplinary tumor board and research group should be there to manage such cancers, and enrollment in clinical trials for cancer-based therapies should be there. So adolescent and young adults form a group, a separate group of patients where in the cancers are relatively rare, but once they occur, the chances of malignancy are very high. Cervical cancer relatively rare in adolescents. Breast cancers very again rare, but those which occur are having a high grade of severity. This is how we can prevent breast cancer. So breast cancer is a preventable disease, and those whose adolescents have a history of family history of breast disorders, and there is a BRCA1 and BRCA2 gene mutation, these should be screened right from age 20. And then there are endometrial cancers, then there are other types of cancers, the vaginal cancers, and so on and so forth. The ovarian tumors form an important part of cancer. Sex cord stromal cell tumors form an important part of cancers. The most important part of cancer is the surgical treatment, the radiotherapy, and the chemotherapy. Now, what toll it is going to take upon the reproductive health of an young adolescent or young adult is that the surgery there can be sometimes a removal of ovaries and the uterus hampering the reproductive potential. Even if the uterus is gone and the ovaries are preserved, fertility can be preserved and there can be surrogacy which can be opted on later on with the use of those ovaries. But if the cancer demands a radical surgery along with removal of ovaries, then the problem comes. After the surgery, is there any if there is any role of preoperative or postoperative chemotherapy? Now, those chemotherapy is going to act in a central mechanism, and therefore, the chances of oocyte damage or the damage to the gametes is very very high. Along with that, radiotherapy, irradiation of the pelvis can cause damage to the oocytes and decrease the ovarian reserve. So, all these three things, that is, the surgery, radiotherapy, and chemotherapy, is going to significantly decrease the ovarian reserve. And in some patients, it is going to cause premature ovarian insufficiency. In some patients, there is going to be oophorectomy or surgical menopause, which is going to occur. So, all these problems are going to come up if the patient has got cancer and we have to go for therapy of this cancer. Now comes the role of future fertility for such patients. And in this era, this century, we should always think about future fertility because the survival rate of cancer has gone up, detection rate of early stage cancer has gone up, and therefore the 10-year, 15-year, 20-year survival is very high, and therefore these patients can think about future fertility. Fertility preservation is very, very important in such adolescents where you are detecting a cancer, going for radical surgery and removal of ovaries. You can preserve either the ovarian tissue, the ovarian cortex, or the oocytes. These oocytes can be either immature oocytes or mature oocytes, which can be preserved by the cryopreservation techniques. Here, if we can see that if the adolescent is having malignant disorders and it requires immediate chemotherapy, we can take ovarian tissue slices, and this cortical ovarian tissue can be transported at 4 degrees Celsius and then can be cryopreserved by slow freezing. Later on, this can be thawed and we can remove the primordial follicles from this, do their in vitro maturation, and use them along with the sperms to prepare embryo. Along with that, uh, there can be this can be used to graft in a medulla in another patient called as artificial ovary, and then this can be used to uh, prepare fresh oocytes. Along with that, there can be orthoptic or ovarian transplantation. So there can be transplantation inside a peritoneal window or graft into the ovarian medulla can also be done. For malignant disorders, we can also have, before the patient goes in for a surgery, this patient can undergo controlled ovarian stimulation and ovum pickup, and we remove the oocytes, which are mature oocytes, and these oocytes can be vitrified by recent techniques, and this can be frozen for years together. When you want to use, you can thaw these oocytes, use along with them in IVF or ICSI, and then prepare embryo and do embryo transfer. If the uterus is there, then transfer there, or if the uterus is removed along with the ovaries, then we use surrogacy or a uterine transplant later on to transfer this embryo. So I think there is lots of hope in spite of the cancer, and adolescent not only adolescent uh, population, but their parents, their teachers, and most importantly the healthcare professionals need to be aware that such techniques are available and future fertility can be preserved, especially in this era where cancer is early detected and treated successfully, so that they can have a good reproductive outcome potential later on in their lives. Along with that, some adolescents also want to do social freezing of their eggs which is also possible. So, fertility preservation forms a good domain to preserve person's own fertility for the years to come. Along with that, there can be preservation of male fertility as well. So, if you have any queries related to fertility preservation in adolescent population, do contact us on our numbers. Our numbers are shown in this picture. So, thank you so much. In the end, I would like to say a few words about women population. बंजर नहीं हूँ मैं, मुझ में बहुत सी नमी है, दर्द बयां नहीं करती, बस इतनी सी कमी है. I think it's the woman population who doesn't speak out, keep its pain to herself, and I think this should not be done, and we should ask them to is speak out and have their opinions and take consultations as soon as possible. So even in adolescence, treatment is possible, fertility preservation is possible. We'll try to take some questions before we go. Do women who undergo IVF treatments have better, more chances of getting cervical cancer? It's a myth associated with IVF, although the question is not related to this topic. But yeah, I'll take this question that there is no increased incidence of any form of cancer associated with IVF treatment. IVF treatment these days has become very simple. Have to undergo ovarian hyperstimulation with gonadotrophins, with or without oral ovulogens, and then there is a ovum pickup procedure after which the IVF or ICSI procedure takes place. So this is a simple procedure of around 14 to 15 days, and where no major interference or invasion is done with a person's body, and therefore is no increased chance of any form of cancer. However, whenever these patients are going for IVF, we generally do a routine health examination, which includes the cervical examination along with pap smear, and therefore this can help detect early stages of cervical cancer. Therefore, I feel that IVF will not increase definitely any chance of cervical cancer, but if the patient is coming to a fertility specialist and the fertility specialist is seeing the cervix and taking the pap smear, this will help to detect early the cases of cervical cancer. The next question is, can hormonal injection cause any side effects? So basically, hormonal injections are the gonadotrophins which are there inside your body. These gonadotrophins, we are purifying them by a process. Then these gonadotrophins can be used in a recombinant form, and therefore they are the same as they are in the body. A little bit higher dose is used to stimulate the ovaries, and therefore this is not going to cause any major side effects. But since the dose is, if the dose used is little bit higher, there can be water retention, there can be mastalgia, and slight minor symptoms can be there with the usage of this gonadotropin or hormonal injections. So no major side effects or no long-term side effects on the body are observed. So that is the question to this question. And that is the answer to this question. I don't see any questions now, and therefore, anyone who is mm, facing adolescent health issues, any issue, and they want to preserve their future fertility, I think they should take opinion of the fertility specialist. Any of your questions related to fertility and adolescent health, we welcome you. You can call us on our helpline number, which is shown below. Any of you want to take consultations related to adolescent health and infertility can visit our any of our centers in Pune. It's at Dynasty Commercial, Kaspate Vakar, and Arisa Avenue near World Trade Center, Kharadi. Thank you so much for your patient hearing. Thank you.